Hey folks, it's Dr. Mike and it's October 2nd. That means it's time for our second 30 for 30. And remember, the 30 for 30 is over the course of the next 30 days, and we're on day number 2 now, so it's the next 28 days. We're going to give you actions and steps to build your medical exercise training practice. So it's October 2nd. It's our second 30 for 30. And this one today is to establish a target medical marketing list as well as a target marketing list for medically based clients. Now you say, well, okay, Dr. Mike, that's not a big deal. Yeah, it is, folks. We've been teaching the MES now for 24 years. And it's amazing to me how our MESs are always so gung-ho after they get that certificate. They're going to go out there and they're going to market to everybody. They're going to work with all types of clients. And usually about a month or so after that, they realize there are a lot of pieces, a lot of moving parts, a lot of loose ends here that they've got to kind of rein in so they can now have the clarity to go out there and start building the practice. So one of the first things we ask you to do, instead of doing the shotgun method of marketing to everybody, marketing to every doctor, every therapist, every chiropractor, every potential client, we ask you to kind of pump the brakes a little bit, slow down just a little bit, and let's now look at a target medical marketing list. So here's what we recommend. We recommend 3 medical professionals if you're a solo practitioner. If you're by yourself, it's just you, you're a one-woman, one-man shop, you're doing everything, we ask you to look at 3 referral sources. General practitioner or internist, number 1. 2 would be a chiropractor, and number 3 would be a physical therapist. Let me explain why. The internist or general practitioner is the gatekeeper to every aspect of medicine. They see everything coming into their offices: hypertension, diabetes, stroke, MS, Parkinson's, low back pain, obesity. They see everything. Okay, so they're the gatekeepers. It's great to establish a relationship with that individual, the general practitioner or the internist, because guess what? They can refer everything to you. But make sure you refer back to our first day where we talk about making sure that you're able to define what medical exercise training is, your scope of practice, and the goals of your programs. Again, you've got to make sure you're able to explain who you are, what you do, how you do it, who you do it to. So first one on that target medical marketing list will be a local general practitioner or internist. Second on the list, a chiropractor. We find chiropractors are very receptive to medical exercise specialists, and this was surprising to us in the early stages of the program. When we started back in the mid-1990s, we had no idea that chiropractors would be an excellent and receptive potential referral source for our MESs. We thought it would be more physical therapists, but we find that chiropractors are far more receptive. The reason is, you offer the chiropractor something that he or she in many instances does not offer in their office, which is exercise. Now, I'm not saying chiropractors don't do it. I'm just simply saying in many instances, because of the nature of the treatment and the number of patients they have to see, they need someone available that can provide the exercise component too. So that's a great situation, and you're augmenting the treatment that they're providing. So second on the list, chiropractors. Third on the list, physical therapists. Now, we put physical therapists down on the list because we wanted you to refine your marketing approach, your presentation before you got there. And let's be honest, there has been and is and still will be some friction between physical therapists and personal trainers or fitness professionals. Now, we don't feel there's any friction between medical exercise specialists, because once you understand your role and scope, you understand how to talk to the therapists, and you understand how to relate to them, and you understand what your role is, and you understand that you aren't infringing on their area, they're not infringing on yours. So we find for our MESs, they normally do pretty good, but for the general fitness professional out there, sometimes they kind of cross the line with what the physical therapist views as their role. Now, we can argue back and forth with regard to what the role should be or what it shouldn't be, but also understand what state law is and provincial law is, both here in the United States and Canada. And sometimes for our fitness professionals, they kind of push the envelope a little bit too far. Now, later on this afternoon, I'll come back with another video that'll talk about that. But what we want to do is, with this target marketing list, instead of shotgunning it and trying to market to everybody, we want you to refine that down. And again, on that list, internist, general practitioner, chiropractor, and third, as I'm talking about now, the physical therapist. Okay? Now, physical therapists are going to send you a wide range of clients, and once you establish that relationship with the physical therapist, and they know, like, and trust you, understand you know your role, folks, the opportunities are enormous. We've seen some of our MESs actually build their practices while renting space inside of a physical therapy clinic. Medical exercise trainers of Washington, D.C. and Atlanta, Georgia, Don Alley and Phil Godfrey started out that way. I'm actually at Medical Fitness Pros here in Katy, Texas this morning, and the owner of the facility, Jason Hodge, started out just that way. He rented space in a physical therapy clinic and got started that way. So the opportunities out there for working with and developing referral relationships with physical therapists are great, but you got to make sure that you've refined your definition of what medical exercise training is in post-rehab, your scope of practice, and what programs you'll have and how those programs will be beneficial to the therapist's patients after their discharge. So this idea of going out there and shotgunning it and trying to get every referral source out there, folks, it just doesn't work. It's overwhelming. And if they do refer everybody to you, guess what? Can you absorb all of those referrals? Let me ask you, how many new clients can you take next week? 4 or 5? And then remember, that new client needs 2 or 3 visits, and then the doctor is going to send more, and then the following week they're going to send more. So if you've done the shotgun approach, and you got 5 or 6 referral sources, it's great, but guess what happens? After a while, they stop referring because you can't take the new client. And is that doctor able to differentiate between you and the personal trainer down the street? I would dare say they can. Some, yes. I would say probably 95% no. So make sure you focus your marketing efforts because you want to build a relationship, okay? Not a friendship, a relationship. And let me make sure you understand the difference between a medical referral friendship and a medical referral relationship. A friendship is, oh yeah, Dr. Smith knows me. I know Dr. Smith. He knows what I do. We've talked a couple of times, but Dr. Smith has never referred anybody. That's a medical friendship. A medical relationship is Dr. Williams, who you may not have ever met. But Dr. Williams has referred people to you, either a verbal referral or a written referral. And the gold standard is to get a written referral. And that's a relationship. He's referring people to you. The other guy over here was just a friendship. He knows about you. He talks to you. He says you're a great guy or a great woman, but they never referred. So make sure you understand the difference between a medical friendship and a medical relationship. Now, in a later 30 for 30, we'll talk about how to move that medical friendship to a medical relationship, because we've done it here at Medical Fitness Pros, and it's a delicate process. Now, you say, well, Dr. Mike, how do you know all this? Folks, I own a number of physical therapy clinics, and dealing with doctors and chiropractors and medical specialists of different areas, it's all the same. It all, for the most part, is the same. It's developing relationships. It's understanding what they want and what they need for their patients. It's managing them. It's communicating effectively, documenting, making sure you have protocols in place. That's what a relationship is. It's not just simply you got the referral. It's all the other things that go along with it. So let me reiterate here. Make sure that you have a target medical marketing list. And if you're a solopreneur, 3 referral sources. Now, I gave you 3. You can pick 3 others. It's up to you. But also remember, as you add additional staff members, you need to add, for every new staff member, you need to add 1 additional referral source. So go out there and start to cultivate that as you're bringing this staff member on. And lastly, that takes us to the idea of a target marketing list from the standpoint of medical conditions. A lot of people say, well, Dr. Mike, I don't want to specialize because that means I can't work with certain clients. No, it doesn't. I specialize in outpatient post-operative orthopedics. That means we did a lot of knee, shoulder, back surgeries. But I saw strokes. I saw soft tissue injuries as a result of car accidents. I saw osteoarthritis. I saw total joint replacements. We saw everything. But what I found was my expertise in outpatient orthopedics that were post-surgical gave me an edge and allowed me to also be good at managing other conditions and other clients from other areas. So it's one of those things, when you go an inch wide and a mile deep, when you're digging that hole and getting that refined knowledge, you're just going to get better at everything. So don't feel like you're cutting off your nose in spite of your face. So this idea of establishing a target market list, do you want to work with total joint replacements? Do you want to work with hypertension and diabetes? When you put that together, that's going to reflect back on your target medical marketing list. So please, if you would, make sure you do both. Now, I want to close this video out before we get to 10 minutes. The key thing with all of this is focus and clarity. I know it's a huge opportunity to work in this post-rehab and medical exercise realm, but you got to have clarity, because once you get clarity and you now have focus, you can do great things in building your medical exercise training practice. So, number 2, or day 2 is simply make sure you establish a target medical marketing list and establish a target market that you're looking at, a target market of medical conditions that you're going to focus in on. And it could be multiple medical conditions, but it shouldn't be more than, say, 3 or so. Now, you can take other clients, but you want to get really good at working with those conditions. So thanks again. We'll be back tomorrow with our third 30 for 30. And if you have any questions for me, email me at drmike@postrehab.com. And make sure you go over and check out our new community for medical exercise professionals, MedX Pro 360. You go to medxpro360.com. It's a community designed to help you refine your skills, produce greater and better outcomes with your clients, and also make your practices profitable. So thanks for listening and look forward to seeing you tomorrow. Bye-bye.